Hello guys, and welcome back to my channel. So if you're just stumbling on my video for the very first time, my name is Dorothy Shitanga and I'm a pharmacist living and practicing in Nigeria. So I put up a video last week talking about some of the causes of erectile dysfunction, and last week we looked at some of the psychological factors that could result in erectile dysfunction. So today's video we're going to be looking at some of the physiological factors that affects people's performance, people's ability to perform properly 100 when it comes to sexual performance. I talk about the physiological factors. There's something we need to also understand, that before now we had this idea that diabetes, hypertension, arteriosclerosis, high cholesterol were things for the elderly. But it will interest you to know that currently we have younger people. There are younger people who have diabetes, we have younger people who are hypertensive, the younger people who have high cholesterol and the rest. So these things are not limited to just the elderly. And because it is not only limited to the elderly, it means that some things could also affect younger people. So one of the first physiological causes of erectile dysfunction is diabetes. Yes, so research has shown that people who are diabetic tend to also have erectile dysfunction, and this is one thing that could cause a decline in the performance of a man if he or she is diabetic. So if you would want to now have a better performance, you need to make sure that your diabetes is well managed. Another thing that causes erectile dysfunction is hypertension. For those who are hypertensive, they tend to also come down with poor performance rate. And then another thing we also want to look at is obesity. Those that are fat, excessively fat. Yeah, excess fat also usually causes erectile dysfunction. And then smoking. Yes, smoking. So if you are in that category of guys that smoke and you feel like when you smoke it tends to increase your performance, on the contrary, you're doing more harm than good to yourself. So if you smoke, you might be predisposing yourself to erectile dysfunction. Alcohol. Those of you who are heavy drinkers, you want to cut down on that, because heavy intake of alcohol has this way of also affecting your erectile propensity. It has this way of affecting how long you're able to stay. Poor sleep. Yeah, poor sleep. Having not been able to sleep properly most of the time affects how well you're able to perform. How well you're able to perform is a function of how much sleep you are able to get, because if you don't sleep you become stressed, and when you are stressed you cannot perform. That's the simple way to put it. So there are some medications that might also predispose you to erectile dysfunction. Take for instance some antihypertensive. So there are some hypertensive medication. Maybe you're probably taking a medication to control your high blood pressure. Those medications could also reduce your libido and also result in an erectile dysfunction. So that is another area I want to look out for. And finally, testosterone, low testosterone level. That aspect has to do with your hormones. So if you're having a hormonal imbalance, I'm sure a lot of persons are usually feeling like hormonal imbalance is a thing for the women. Well, for the records, men also have a hormonal imbalance. So for some men, they might have higher levels of some hormones and lower levels of some hormones. So take for instance, for a man, if you have a lower level of testosterone, then there's a possibility also that your performance would also be affected. There are other factors that could also result in erectile dysfunction, like having injuries in that area that damages the nerves that controls your performance and the rest. These are some of the things that can cause erectile dysfunction. There are medications, for the records, there are medications that can be used to control or to manage erectile dysfunction, which I'm going to be talking about in the next video. So make sure that you anticipate and you look out for those videos. Until I come your way next week, do take care of yourselves and bye.